In some horses, in association with an osseous cyst-like lesion, the lameness may vary spontaneously within an examination period, so the results of diagnostic anaesthesia are difficult to interpret. This was a 7-year-old hunt horse, and on initial clinical examination, the horse showed obvious grade 4 out of 8 right forelimb lameness. There was no response to distal limb flexion and no clinical signs referable to the distal limb. We started by performing nerve blocks, and palmar digital and palmar nerve blocks performed at the base of the proximal sesamoid bones produced no alteration in the gait. Following perineural analgesia of the palmar and palmar metacarpal nerves, a so-called low 4-point block, the horse appeared to be sound. And I was very surprised by this because it didn't seem consistent with our previous clinical observations. However, I went back to the horse about half an hour later, and the lameness had returned to baseline levels. So it would appear that the lameness had spontaneously resolved, only to recur with time. And this was a very consistent pattern, making it difficult to interpret the results of any diagnostic anaesthetic technique. So the horse underwent skeletal scintigraphy, and we can see focal intense increased radiopharmaceutical uptake in the distal aspect of the scapula, which was associated with a large osseous cyst-like lesion that we can see radiographically, which appeared to communicate with the scapulohumeral joint. And I would say that this is a not inconsistent clinical presentation of some of these osseous cyst-like lesions. Very sporadic and quite obvious lameness that may resolve spontaneously, only to recur within half an hour to an hour later. We quite commonly see episodic lameness in endurance horses and lameness occurring during competition after a minimum distance covered of about 25 miles. The horse on the left had just such a clinical presentation, and at the time of clinical evaluation, no lameness was observed. For that reason, the horse underwent skeletal scintigraphy, and we saw focal, mild, increased radiopharmaceutical uptake in the third carpal bone. These are not very good quality skeletal scintigraphic images because there was poor radiopharmaceutical uptake even after acquisitions of 3 minutes duration. This increased radiopharmaceutical uptake is not typical of an incidental finding in endurance horses and was associated with fairly intense increased opacity of the radial facet of the third carpal bone. So we have sclerosis of the radial facet of the third carpal bone. And in endurance horses, we have to remember that we quite frequently see lesions that we would more typically see in thoroughbred race horses than in other sports horses. These are images of another horse with episodic lameness occurring during competition, but resolving very rapidly within 24 hours of competition. And this horse has got chronic proximal suspensory desmopathy,